Have you heard of the male G-spot or the P-spot? I'm Dr. RENA Maliik, urologist and pelvic surgeon, and today we're going to talk about prostate massage or stimulating the male G-spot. Now, over the many years I've been on social media, I've gotten loads of questions about prostate massage. People want to know, is it safe? Does it actually help anything? And what about helping with BPH or sexual function? And today I'm breaking down what is the truth. First, let's start off with some basics. What is the prostate, right? The prostate is a walnut-sized gland that sits below the bladder, around the urethra, and the main purpose of the prostate is to create prostatic fluid, which expels with semen. This fluid functions to nourish and protect sperm so it can survive in the female genital tract. The prostate also contracts during orgasm, which helps propel that semen out of the body. And the prostate itself is surrounded by nerves, which can make stimulating this area very pleasurable. Now, prostate massage is a manual technique where pressure is applied to the prostate gland, either to express fluid from the prostate, which is something that urologists have done in the past to treat certain conditions or diagnose certain conditions like prostatitis, or it's done for sexual pleasure. Now, the most direct way to massage the prostate is internally. That means through the anus into the rectum with a finger. And so the person who's performing the massage would wear a clean glove, wash their hands, trim their nails, avoid any injury, and you want to use a lot of lubricant. Ideally lubricant that's designed for anal use because the pH of the rectum and the vagina are different. And so you want to make sure you're using something that is isoosmolar or similar to the pH in the anus. Once you have a well lubricated finger, it's gently inserted into the anus about 1 to 2 inches in and angled upwards towards the belly button. Here you're going to feel the prostate. It sits right in front of the rectal wall and feels like a smooth rounded bump or like the tip of your nose. That's kind of the feeling that you'll feel. And you can gently massage that area and stimulate the gland. Now, the most important thing here is to be gentle. If you're too rough or you have too much pressure, you can cause pain, you can cause injury or bleeding. Because remember, the anal tissue is super friable. You can also get specialty toys that are designed to massage the prostate or help you massage the prostate that can are angled in such a way that'll get to the spot you need to. But of course, always keep them clean and make sure that you're using something that is designed for the anus. You certainly don't want to get anything lost in the anus, and let me tell you, it happens all the time. Now, some people online claim that you can massage the prostate through the perineum, or the area between the scrotum and the anus, which is also affectionately called the taint. However, I'm a reconstructive urologist. I do surgery in that area all the time to fix things like urethral strictures or narrowings. And when I'm doing these strictures and they're very close to the prostate, meaning they're very proximal, it is very difficult to get to the prostate. Even with surgical instruments, it's surrounded by the pubic bone. And so sometimes when I need to get to that area, I have to remove part of the pubic bone to really get to the prostate. So to be able to stimulate it from the perineum is very difficult. However, perineal massage can be very pleasurable. And the reason is the corpora cavernosa, are those two cylindrical bodies where you get an erection. Those extend deep into the pelvis and curve downwards towards the perineum. So when you're massaging that area, you're also massaging the erectile tissue, which can enhance sexual pleasure. It could also maybe palpate some of the pelvic floor muscles through the perineum, and so that may also be helpful in relaxing those muscles. Now, historically, prostate massage for urology was used as a therapy for prostatitis or prostate inflammation. However, most of the evidence is pretty thin. And if you want to check out my last video on prostate massage, I cover a lot of that there. But does prostate massage actually help BPH or enlarged prostate? Now, BPH is an exceedingly common problem that men have as they get older. About 80% of 80-year-olds will have BPH, and it can cause urinary symptoms like urinary frequency, going often, going urgently, waking up at night, or having a weak stream, waiting for your stream to start, or having your stream stop and go. Now, you might hear, again, people online saying that prostate massage clears out the prostate, but As of right now, there's no strong evidence that regular prostate massage actually improves symptoms or shrinks an enlarged prostate. Now, it might feel good, and that's great. And remember, this tissue is really delicate. So if you're doing aggressive massage, or you're doing it very often, and you're not doing it safely, you can have bleeding. And in rare cases, if you have infection or inflammation or even existing cancer, you can worsen your symptoms. Now, let's talk about sexual function, because as I mentioned, prostate stimulation is a source of pleasure for some, and people are curious about it. So is the prostate really a magic button for better orgasms? Well, it's so-called the male G-spot, right? And as I mentioned earlier, the prostate is surrounded by nerves that help with arousal and erections. And for some people, stimulating the prostate can feel very good and enhance orgasms to be stronger and more robust. In fact, when they do research with large surveys, some people report that prostate massage makes their orgasms more intense or more pleasurable. However, it's not guaranteed for everyone. In those same studies, while some people enjoy prostate play, others can get pleasure just from having sensation of stimulation to the anus or even just a sensation of fullness in the rectum. And for some people, when they don't like it, that's okay too. You can still have great pleasure and enjoyment without prostate massage. So if you're interested in trying prostate massage, let me give you a few tips. Number one, always have consent. Talk directly to your partner. I want you to stimulate my prostate, or I want to stimulate your prostate. Use gloves or a clean, well-lubricated finger or a toy that is designed for anal use. The rectum does not self-lubricate like the vagina does, so you need to include lots of lube. Go slow and go be gentle. However, not everyone should try this. If you have acute prostatitis, meaning you have an active infection of the prostate, this will worsen your symptoms and maybe even land you in the hospital. If you're having severe pelvic pain, fevers, or chills, that might be a sign that you have prostatitis. If you suspect you have prostate cancer or have known prostate cancer, theoretically prostate massage might worsen the prostate cancer, although I haven't seen it in clinical practice, but it's something that we always say. So bottom line, there's no solid evidence that prostate massage helps with BPH or urinary symptoms. It can help with pleasure in terms of sexual function, but it's not necessarily going to help with erections or libido or anything else like that. Everybody's body responds differently, and it's not a miracle that you need to incorporate in your sex life, but it could be really fun. If you found this video helpful, make sure to share this channel with a friend or family member that you think would be beneficial, and subscribe. It is a zero-cost way to support the channel and get more evidence-based information about your sexual health and more. And as always, remember